Yes, well, it's perhaps not unexpected, though of course it's very sad that these numbers are going up. But we have, of course, seen the easing of lockdowns, and we've seen people socialising more, having those barbecues and going, as you say, off on their summer holidays. So in the latest figures, the UK has recorded another 2,948 new infections in the last 24 hours, and that takes the rate of new cases above 20 per 100,000. 3 more coronavirus deaths were also reported, taking the total to 41,554. Now, today the government also announced the lifting of some of those air bridges, some quarantines for more of the islands in Greece, as our business and global trade correspondent Paul McNamara now reports.
An island paradise, or as of this afternoon, holiday hell for thousands of tourists. Holidaymakers returning to England from the Greek island of Santorini after 4 a.m. on Wednesday will now have to quarantine, as they will from Crete, Zante, Lesbos, Tinos, Seriphos and Mykonos. It's the news anyone rolling the dice holidaying abroad this summer has feared, sold in Commons as a progressive step in the fight against the spread of coronavirus.
For the first time, we have the data and the capacity to add and remove specific islands from quarantine.
So Greek islands, and not Greece as a whole, have been added to England's quarantine list. No change though for people hoping that Spanish islands might be removed. There was the possibility of movement on one other key issue though, testing.
So we are working actively on the practicalities of using testing to release people from quarantine earlier than 14 days. This could not be a pure test on arrival option. It would not work. But my officials are working with health experts with the aim of cutting the quarantine period without adding to infection risk.
Testing travellers is already part of the coronavirus strategy in several European countries. In Germany, if you arrive from a high-risk country but with a negative COVID test no more than 2 days old, no quarantines required. French airports test on arrival. A negative result, usually received within 2 days, means no quarantine. In Iceland, you can take a test on arrival. A negative result is followed by another test on day 5. If that's negative too, quarantine ends. And in Austria, Vienna Airport is offering tests which are turned around in a few hours. Get a negative result and there's no quarantine. A possible move the travel industry is desperate for. At Heathrow, they've already installed the infrastructure for testing on arrival, but its staff right now, grounded. And at the lab where Heathrow tests would arrive, they're currently running private coronavirus testing and analysis.
And that takes about an hour then to give you these results.
Their hope to ramp up capacity if the government changes policy.
It's not just the speed, but claims over the accuracy of these tests, which is frustrating travel bosses who say quarantine is killing an industry already on its knees. The government, from the Prime Minister down, keeps on saying that there's no point testing people at airports because it only picks up 7% of cases of coronavirus. The boss of this company says that is simply not true.
The model only uses one external source of scientific data, and that paper doesn't relate to testing at all. So there is no scientific data that supports the claim that it's only 7% effective. But the government are treating this as fact. It's not fact. It's just a model based on assumption.
The government say they are working on using coronavirus testing to cut the 14-day quarantine period, but with no specifics on timing. Slim chance of a change before people return home from Greece after Wednesday morning for another 2 weeks off work they didn't bargain for.
Well, there has been a lot of government finger-wagging specifically at young people. Now, I'm here in Borehamwood in Hertfordshire, where the council has announced a big spike in cases, and specifically in 16 to 19-year-olds. They said in the last week of August they were going out partying in private homes, and the council said, Hertsmere Council said, they have now written to their parents, so they will have a letter winging their way. Earlier in the day, I was in Bishop Stortford at the high school there, and I was speaking to some 17-year-olds in their bubble who have just gone back to school. And one of the messages they had was to the government, is speak more clearly to them.
I think we were always told that our age group wasn't really an issue for for coronavirus and actually infection rates. We've been told this the whole time.
Do you recognise that? So it's almost like mixed messaging.
I think there's been a lot of mixed messaging, and this is just sort of another step of this government's mixed messaging throughout this entire pandemic.
But I think that a lot of us are being vigilant, but it really depends on the situation you're in.
What do you think when you hear, the Prime Minister and the Health Secretary saying, oh, it's young people who are driving the infection rates? Does that upset you?
It's upsetting, but I'm not surprised because we've all come back to school and we're all sitting like really close to people. We're all in a bubble together. So I'm not surprised if it would go home and then spread amongst our parents and our friends.
But are you partying? Are you out, doing what young people really ought to be doing?
I think it's difficult because having not seen everyone for like 4 months, 5 months, when the guidelines, were loosened, people took that as an opportunity to kind of resume normal life. But I think all of us are sensible, so we're not, exceeding the guidelines.
You've thought obviously very hard about it.
Yeah, I think it's important. Like, obviously I saw my grandparents when I could, dropping shopping on the doorstep, and my grandma's really vulnerable. She's got, cardiac issues and things. She's like in the top risk factor group. So when you see your grandparents like that, extremely vulnerable and scared, like I think all, older generations are scared. Like, I wouldn't want to be responsible for, causing her to get it just because I fancied a hug.
What officials here are looking at with some concern is what's happening in France and Spain, where the numbers are going up, driven by young people, it would appear. But they're seeing, for instance, in France, some cases in Marseille where it has then gone on to be transmitted to elderly people, and they are now seeing some deaths. It must be said that here the numbers are still relatively low and the deaths are very low. But they need to keep an eye on this. We've got maybe a 2-week time lag behind those countries, and that gives them 2 weeks to make sure the test, track and trace system is up and running much better, and that they can isolate those pockets where the infections are rising steeply.
Thanks, Victoria. Well, we asked the government to speak to us about the rise in coronavirus infections. No one would come on.